Yeah. So we'll be starting very shortly. In about 2 minutes, would kick off today's session. So please invite your colleagues, invite your friends to join us because we'll be starting very shortly. But in the meantime, you could just type in the comments chat your name, your country, and of course your area of specialty. For example, you could just say, my name is Beulah Suleiman, I'm from Nigeria, and I'm a medical doctor, or my stream is veterinary medicine, stuff like that. So we know where everyone is joining from. Thank you very much once again and welcome. So I believe we can start now as we have about 45 participants on this call. So good evening, everyone, once again. Welcome to today's session, to this webinar on youth sharing and learning. My name is Beulah Suleiman, and I'm going to be your moderator for today. So, of course, I'm speaking from Nigeria, as well as also a team member of the Joseph Blue Foundation. So just to welcome us once again, thank you to our participants for, typing in your names, area of specialty, and of course, their locations. I mean, we've seen some of our participants are joining from Tanzania, from Nigeria, from Zambia, from South Africa, from Kenya. Wow, that's a very, great spread across the African continent. So thank you very much once again for joining. Today, we're going to be having a joint webinar between the SU Africa Global and Public Health Student Network Initiative and the Joseph Blue Foundation Internship Mentorship Program. So in today's meeting, in today's webinar, you're going to be learning more about the SU Africa Global and Public Health Student Network Initiative, which of course is founded by Professor Renee English Well, you're also going to be learning more about the Dusibly Foundation Internship Mentorship Program, which of course was founded by pharmacist Estelle Mbadiwe. You're also going to improve your awareness and knowledge about antimicrobial resistance and One Health in Africa. You're also going to be learning so much about global health. You're also going to be, networking and connecting with other participants on this call. I believe we have interns from SU Africa, Global and Public Health Student Network Initiative, as well as interns from the current cohort of the Dusibly Foundation Internship Mentorship Program. So today's session is going to be rich, and I assure you that you're going to, be in for a ride with regards to the knowledge you'll be acquiring, as well as the connections you'll be making into this session. So without further ado, next slides, please. So just to run quickly through the agenda for today's webinar. So we're going to take the welcome and introduction, which I already did. We're going to also be going through the objectives of today's webinar, as well as an overview of the SU Africa Global and Public Health Student Network Initiative. We're also going to be having an overview of the DBF One Health AMR Internship Mentorship Program, as well as we're going to be introducing our speakers. Some of these are speakers who, of course, will be making presentations. We're also going to be having questions and answers. And then we would have some sort of breakout room to ensure you're able to network and, connect with other young public health professionals in Africa. Next slides, please. So a few housekeeping rules for your notice. It is important to mute your mic when you're not talking. As you join in, ensure to mute your mic immediately. It's also important to raise your hand if you want to speak. So there are some reactions below your screen you can use. You can use that to indicate a raise of hand when you have a question to ask or an opinion to raise. It's also important to say thank you after you've finished speaking. It's also important to respect the opinions of others. As you already know, this is a Pan-African webinar. So we have Africans from different countries joining this webinar. And we're all from diverse cultures, and several other multicultural teams. So it's really important to respect the opinion of others. Next slides, please. So the key objectives of today's webinar is first to introduce you to the SU Africa Global and Public Health Student Network Initiative. We would also introduce you to the Dusibly Foundation One Health AMR Internship Mentorship Program. We would also have sessions on global health, as well as AMR and One Health in Africa. We also intend to facilitate knowledge sharing and learning among interns from both programs, that is interns from SU Africa Global and Public Health Student Network Initiative, as well as interns from the Dusibly Foundation. Also, we intend to use this webinar as a platform to ensure you're able to network and connect with other young public health professionals within Africa. Next slides, please. So right about now, I'll hand over to my colleague, pharmacist Charles Ogu, to take over. Over to you now, from Charles.
Yes, thanks a lot, Beulah. My name is pharmacist Charles. So for us to kick off this webinar, please, I would like to engage everyone here to please. I know probably most of us might be using our phones or laptop, but you could just indulge me by going to slido.com, and I want you to just go to slido.com. Once you go to slido.com, click on you will see an icon saying enter number. So you'll go there and then enter this number here you see on the screen, 1435065. So click and then press enter. Once you do that, please, you can answer this question here. What are the barriers to youth inclusion in public health? just give me a brief answer. I can see two people typing. It's just a simple data collection tool. I want to get your thoughts on this. Everyone here on the call, just kindly indulge me. Go to slido.com and then type in this number as you see here, 1435065. One word, please. One word would be most appreciated, please. If you can type in just one word. What are the barriers to youth inclusion in public health? I just want to get a feel of everyone here so we can be on the same page. No, I didn't say you should type in the number. When you type in the number, it will give you access to this particular platform where you can see everyone's response here. So just type in one word. What do you think are the barriers to youth inclusion in public health, please? I believe everyone can see my screen. Great. So I'll just give us, we're about 69 here. So I'm hoping to get like 30 responses because we have 20 responses so far. Okay, so we have a lack of mentorship, lack of opportunity, lack of experience, access, information. So you can keep in typing in your thoughts as you have access to this particular platform. So I will just quickly hand over to Beulah, please. Beulah, you can continue from there. Thank you very much for engaging with me.
Okay, thank you very much, Pharmacist Charles Ogu, for that. Thank you to all our participants, for typing in their responses to the barriers to youth inclusion in public health in Africa. So just to reiterate again, we are honored to have the presence of Professor Renee English as well as Pharmacist Esther Mbadiwe on today's call. So right now, I'd like to hand over to Vanessa Dede-Enen to, introduce Professor Renee English and, just take on this session. Thank you.
Thank you so much for the handover, Beulah. I have the privilege today of introducing Professor Renee English. Professor Renee English is a medical doctor and public health medicine specialist who holds a doctorate degree. She has a vast range of experience when it comes to clinical and health systems research and has been involved in various aspects in the development of various things. Of significance is the practical approach to lung health in South Africa, which has subsequently been expanded to the PAC guideline, which is used. She was the head of health systems research at the Health Systems Trust and has also served as the co-editor for the South African Health Review and District Health Barometer publications. She's a past fellow of the African Science Leadership Program and is currently the head of the Health Systems and Public Health Division at the Department of Global Health at the Faculty of Medicine and Health Sciences at Stellenbosch University. Prof. English, we're so glad to have you today for this session, and I would like to hand over to you.
Thank you very, very much, Vanessa. It is truly an honor to be here today. I'm very excited to be here. I'm very excited to be with all the colleagues. So thank you very much for the invitation. Before I start, I really want to just acknowledge and thank Estelle Mbadiwe, the founder of Dusit Blue Foundation, and also my co-fellow on the Kofi Annan Fellowship program. I'm really honored to share this webinar with her. And as we have been talking over the past few months as we started our fellowship, we truly do share a passion for global and public health and young people in common, and we have this vision for uniting young people in terms of public and global health, and we have a Pan-Africanist view. So my colleague from West Africa, a dream come true, I know, for both of us, and I'm really excited, and so is our team, to hear what you've been doing with your team over the past few years, and certainly the past few months. So what I will be talking about is an initiative that I started along with a group of students and along with a group of staff members at Stellenbosch University, where I am the head of the Division of Health Systems and Public Health in the Department of Global Health. And we've called it the SU Africa Global and Public Health Student Network Initiative, and I'll be speaking more about it now. Thank you. Next slide. And so why did we form the initiative? And I'll be speaking about that. I'll be introducing the core team, and I'll be very briefly going through why global health. Why are we focusing on global health? Thank you very much. Next slide. And so the purpose of the SU Africa Global and Public Health Student Network is to build African Global and Public Health Network, essentially a community of practice that comprises of experts as well as students, but one that is primarily student and youth focused and is aimed at enhancing the knowledge, the practice, and the skills regarding priority current and future global and public health issues as they are relevant to the African continent. And using health professions education theory, so particularly transformative learning theory, we're hoping that through the process of engaging and immersing yourself within a community of practice, students will become transformed to be change agents and leaders locally and globally, but focused on the African continent. And so as we move together, we hope that we will be able to co-create this project with students. We'll be able to build networks into Africa, and we'll be able to share learnings and experiences, both as faculty, but also as students, and also with the community and our policymakers. Thank you very much. Next slide. So why the need for this? COVID-19 has shown us that despite the challenges that we as a continent face, we are able to respond, both at a local level and as well as regional and a continental level, to emerging infectious diseases, re-emerging diseases, and essentially to public health crises. We have the capability to do so. We don't always have the resources to do so. And what we do need is we need to leverage our lessons learned. We need to leverage the expertise on the continent to be able to ensure that for some of us who have gone before, that we do instill these leadership capabilities, the knowledge and the skills within the next generation. And so using those students who are studying in the health professions and beyond, we are able to foster that vision. At a more personal level, this initiative also started because I teach public health to undergraduates. I teach public health and health systems to postgraduate students as well, but particularly the undergraduate students across the years that I've been doing this, and also across the actual years of training, have approached me and said, you know, we really want to learn more about public health. We want to know more about global health. We run a short course called Introduce an Introduction to Global Health. And students were saying, well, when do we learn about these things? Well, this is what the initiative is all about, is to build your capacity. Thank you. Next slide. And so the context for this initiative is primarily, given its focus on the African continent, is it leverages very much on the fact that the African Union, as well as the Africa CDC, which is newly established, it's about 5 years old, has prioritized public health on the continent. And Africa CDC has developed a strategy called the New Public Health Order for Africa, which they said, now I'll read the quotation, seeks to address deeper structural public health deficiencies at national, regional and global levels. And we'll share the slides and you'll be able to access the document and read it in your own time. Thank you. Next slide. And so what will we do? We'll be doing a number of activities locally here within South Africa and in collaboration with this broad network of students that we have across Africa. And as we will hear from Vanessa, the students, particularly led by her, using the existing networks into Africa has already formed a group of students who are part of this process. And so some of the activities will have a more continental reach and some will be focused, but we hope that in the future we'll be able to replicate our activities at a more local level. So 2 weeks ago, we had our launch and we introduced this initiative to those students and other interested students. We today are using this jointly presented webinar to kickstart our own webinar series, which will be called Introducing Global Health, African Perspectives. And at the end of my presentation, I'll give a brief overview of the topics that we'll cover. We will also be leveraging on social media communication, and we'll be using that to think through some of the challenges that exist. We will also challenge the students in that way and start a conversation and build on existing conversations that may well be happening in Dusit Blue Foundation, for example, to reach our objectives. We also have a number of learning or capacity building sessions. So we have a social innovation, design thinking session planned, and we have people who are both skilled within the methodology as well as skilled in applying the methodology in the field who will come and speak to the students. And then we also plan field visits which will stimulate dialogue on local, global public health issues, or should I say global and public health issues that are locally relevant within our setting. Thank you. Next slide. So I'm going to hand over to Vanessa, and Vanessa will introduce our team, our core team, and she'll speak about the countries that are represented in our broader African team. Thank you, Vanessa. Over to you.
Thank you so much, Prof. So my name is Vanessa Anand, and I'm a final year medical student at Stellenbosch University in South Africa, and I'm part of the core team along with Prof. English, Hlakanipha Changalanga, who is a 5th year medical student, and Toluwani Adeboye, who's a 3rd year medical student at Stellenbosch as well. It would be possible for the two of them to put on their cameras and just briefly introduce themselves before we move on to the core members of staff.
Hi, good evening, everyone. I'm not sure if my camera's on, but my name is Tolu. I'm a 3rd year medical student from Stellenbosch University. I am part of the core team for the SU African Global Public Health Student Network, and I'm looking forward to embarking on this journey with everyone on this call and those who join us in the future.
Okay, I assume Hlakanipha is perhaps having some issues with his network. We can move on to the core team being members of staff.
Hello, everyone. I'm so sorry. My reception might be...
Vanessa, I think we will have to move on then. Sorry, Hlakanipha.
Okay, so moving on to the core members of staff, we can go to the next slide, Tolu. So we have Stacey Blows, who's a PhD student and coordinator within the Division of Health Systems and Public Health. Willie Dube, who's also a PhD student in the Division of Molecular and Biology and Human Genetics. We have Dr. Juliet Naisulu, who is a senior lecturer in the Division of Public Health and Health Systems. And we have Dr. Lynn Hendricks, who's also a lecturer in the Division of Health Systems. Just in terms of countries represented, we'll be briefly playing a video which will display which countries are represented, but we have a core team of students from across the continent, and we're still trying to expand our core networks. So in terms of countries represented, we have students representing Nigeria, Uganda, Cameroon, etc., which we'll clearly see our core team in the video that Tolu is about to play. Okay, I think while the video is being sorted out to be played, which will display how far the network expands, I will just briefly talk about the core team of students. One second.
Apologies, everyone. Can everyone see the video and hear the video?
We can see the video, we haven't been able to hear the video yet.
But I think let's
Okay.
leave it so that everyone can just see the countries that are represented, and we can share the video for everyone to hear with the sound. Thank you. I think we can continue now, Vanessa. Thank you.
Okay, so just to, apologies for the video, but just in terms of countries represented once again, so there's the team from South Africa, we have representatives from Cameroon, from Nigeria, from Kenya, we have people representing us from Sudan, Malawi, Uganda, Liberia, and that is how far our network currently expands in terms of our core group of students. So this core group of students is responsible for assisting in terms of the brainstorming project, a part of the project, and ensuring that what we are planning doesn't necessarily, it is context specific, but can also expand into different contexts. So looking at what the different public health and global health issues are in different African countries, and how we as students can come together and brainstorm and think of solutions for these as a way of skills building, equipping in terms of knowledge, and skill sharing in this regard. So that's where our network expands, and we would like to have more of you joining us from different parts of the continent, and representing the countries that aren't yet represented. Thank you, Prof. Over back to you.
Thank you very much, and apologies for that. We had multiple tries with the video, but the gremlins creep in. So let's move on with the presentation. So what I'm going to do now is I'm just going to give a very brief overview around why global health. I think the whole issue around global health versus public health versus international health is not always well understood. And so I'm going to move on to just talking a little bit about that very briefly. So when we think about public health, we tend to think of health in terms of a particular community or a country. International health is often thought of as low-income and middle-income countries, whereas global health, those are issues that transcend national boundaries. Things like malaria, like COVID-19, for example, but also other issues like trade-related issues that speak to food security, for example. Climate change is an example of that. And when we look at it in terms of levels of cooperation, at a global health level, it often requires global cooperation. So if we think of the framework for tobacco control, that's an example thereof. Whereas public health, and this can be argued, and that's what we hope to do as we do the series, doesn't always require global cooperation. When we speak about individuals or populations, public health is often focused very much on prevention programs, whereas international health is prevention programs and clinical care of individuals, much the same as global health. Access to health really is, in public health, it's often about access or health equity within a nation or a community. International health is often about going to another nation. It's about other nations and seeking help from other nations or going to other nations. whereas global health is concerned about health equity among nations for all people as a key objective. Global health is highly interdisciplinary, it's multidisciplinary, it moves beyond the health sciences. And again, Estelle, I think your program is a great example of topics and disciplines that extend beyond a single discipline. And so Copeland presents a definition of global health that is often widely used but contested, and we'll talk about that in our seminars or our webinar series. It says that global health is an area for study, research, and practices that places a priority on improving health and achieving equity in health for all people worldwide, emphasizing the transnational issues, determinants, and solutions, multiple disciplines beyond health sciences, focusing on this intersectoral or interdisciplinary collaboration, and is a synthesis of population-based prevention with individual level clinical care. Thank you. Next slide. And so what the next slide just does is it summarizes how thoughts around global health and global health issues at a high level have changed over the years. We started with colonial medicine, which was about facilitating colonial expansion within the tropics to cater for the settlers, to make it easier for the settlers or to prevent the settlers from getting ill. International health, as I explained earlier, was very much about how do we go and sort out a problem in a particular area. We're coming with our expertise, or we need expertise from elsewhere. And the graphic shows the development of the World Health Organization, which was established post-war to foster international collaboration to improve public health relations, to the Alma Ata Declaration, with which we are all familiar, as most of us are familiar with the International Conference on Population and Development, the UN Millennium Development Declarations, Sustainable Development Goals, and of course, the COVID-19 pandemic. Thank you very much. Next slide. And so just to emphasize the multidisciplinary nature of the field, we can see that if one sees it as an elephant, you look at it from different perspectives, and it's about bringing those perspectives together to say, oh, it's an elephant. And so it does include political economy, history, science, sociology, anthropology, and many, many more, as are mentioned on the slide. So next slide. So what we hope to do is to introduce, through hosting a webinar series where we invite our students and our colleagues from other African countries to talk about some of these issues. So we have, our next session is focused on equity and global health, and for everything we have an African perspective. And so we've invited Professor Jimmy Volmink and Dr. Toma Choki, both of whom work in this field, are interested and have written on this. We'll be talking about global health actors and African perspective. We'll also be talking about global health trade and policy. And then we'll have our students who will participate, present about their local, either regions or countries, so that we can start to learn from each other. And then finally, for this session, we'll end off with global health security and protection. And then we'll kick off our next round of webinars a few months later. So that's me for now. We hope that many of you will be able to join the webinars. We plan it for, the dates and the times are on the slide. We plan to have them at 5 to 7 so that we can cater for students. And please feel free. There will be a copy of the flyer in the chat, and please feel free to sign up. So thank you very much, and over to you again, Beulah. Thanks.
Wow, thank you very much, Professor Renee, for that very fantastic presentation on global health, as well as the great work you're doing with your initiative. So I'd like from Charles to please continue to share the screen. Okay, great. Thank you very much. once again. Just as I mentioned earlier, as I said that we were really honored to have the presence of Professor Renee English, who's the founder of the SU Africa Global and Public Health Student Network Initiative, as well as the presence of Pharmacist Estelle Mbadiwe, who's the founder of the Juicy Blue Foundation. So now we've, listened to Professor Renee. She's mentioned all the great work she's doing with the initiative. So I would like to, introduce Pharmacist Estelle Mbadiwe. So she's the founder of the Juicy Blue Foundation, and she's a prominent figure in global health, known for extensive project management experience at national, regional, and international levels. She excels in clinical practice, policy influencing, and strategic planning, and is committed to advancing the African health sector through our health consultancy. She's also a Kofi Annan Global Health Leadership Fellow of the COP3. Some of her areas of interest includes antimicrobial resistance, youth leadership, data for health solutions, local innovation, patient safety and quality service delivery. Pharmacist Estelle champions public health initiatives in Africa, and she's inspired by Nelson Mandela's words, which is, it always seems impossible until it is done. So I'd like to hand over to Pharmacist Estelle Mbadiwe for remarks, as well as to give an overview of the Juicy Blue Foundation AMR One Health Internship Program. Over to you now from Estelle. Thank you for honoring our invitation.
Good evening, everyone. Thank you so much for having me. Thank you so much. If you can hear me. Thank you so much, Professor Renee, for sharing this platform with me. Like you said, we're both Kofi Annan Fellows, and it's been a long journey to get here, and we're really happy to be here and share this platform. So if you permit me, I'll share my screen. Okay. Yes, I think you can see my screen now. Can you see my screen?
Yes, we can.
Perfect. Okay, so thank you so much, Prof. Renee. That's a big shoe to fill to follow you. Your presentation, which was awesome, and I'm so excited to hear about the great work, and the Juicy Blue team will definitely participate in that and be part of that journey. So I want to give an overview of our internship mentorship program. Like Beulah introduced, I'm the founder of Juicy Blue Foundation, which Juicy Blue Solution is actually the principal company, and I'll give you a quick insight into that. So this session is really to share, to give the opportunity. We've had this cohort run for 3 cohorts now. We're on the 3rd cohort, and we know that, of course, there's a limited number that can get in. So we wanted to expand the opportunity for those that could not get in with previous cohorts to also get some insight into antimicrobial resistance and our program, and also into global health. So this was a very intentional webinar that we used to do that. So in terms of an outline, just give a quick introduction of who we are, discuss antimicrobial resistance, a quick short insight into the journey of antimicrobial resistance from our point of view and how it relates to our program. And then we talk about our youth strategy for innovation. We talk about our youth against antimicrobial misuse project, which this internship falls under. And we'll then discuss, what roles you could play as future global health leaders in addressing this global health security issue. So at Juicy Blue Solutions, we're a healthcare consultancy that we focus on improving the quality and safety in the healthcare space. We're very Pan-African facing, and we do this in various ways, as you can see on the screen. But antimicrobial resistance is one of our strong areas of focus, and we've worked at the national, regional, and global levels addressing this. And then we decided, a few years ago in 2020, specifically, we decided to start this mentorship internship program and engage the youth. As we know, in Africa, we've got over 60% of the population are under 25. So this is a huge demographic that we know that we can't ignore. And there's a lot of passion and strength that we can do with the right guidance and tips and tools for them. So the Juicy Blue Foundation is the NGO arm of the company. So let's go to the journey of antimicrobial resistance. Some of you may know about antimicrobial resistance and, having, seen the participation of where you're coming from and what programs your areas of specialty. So we're saying that this is it's resistance of a microorganism, so bacteria, fungi, viruses, and parasites, to an antimicrobial medicines, to which, very importantly, they were originally sensitive to. Very, very important. So this resistance is because of, it's an unstoppable phenomenon. It's based on, the misuse of antimicrobials. And, in the African context, we're talking about it from the point of view of excess use. And then there's also the challenge of access to antimicrobials. So we have a double whammy in terms of our challenge in the African region. So what we're saying is that this is a One Health problem. And what this means is that we can't address this from the human health alone. We have to address this from the animal health, the human health, and the environmental health. So that's what is called the One Health approach. And this is very, very important. And this is a very important theme of our internship program, to get that multidisciplinary team working, as also alluded to with Professor Renee in her presentation. So we know that the prescriptions and the drugs used and the treatment used in humans can also be used in animals, and then the resistant bacteria arising in humans can also in animals can also impact us in the human health sector. So you can't really do this as a one sector alone. So I'm just going to play a video to just encapsulate the journey of antimicrobial resistance. So sit back and enjoy. I hope you can hear me. You can hear the video. Can you hear?
Following the discovery of
Yeah.
penicillin in 1928, antibiotics have saved millions of lives around the world.
We unfortunately can't hear the video anymore. I think you might have to unmute your mic.
Sorry, ma, we can't.
Know enough to take this global threat seriously.
Sorry, can you hear?
And what happened?
Now we can. Thank you.
Sorry, I muted it.
Has
That's sorry.
stimulated bacteria to develop resistance
Good now.
mechanisms to survive. For many years, we did not know enough to take this global threat seriously. And although awareness and involvement has increased, much damage has already been done. Antibiotics are often prescribed unnecessarily for infections that are likely to go away without treatment. In many countries, antibiotics are also sold over the counter without a prescription from the doctor. At the same time, in many low-income countries, lack of access to antibiotics actually causes more deaths than resistance. Multi-drug resistant bacteria spread within hospitals as a result of poor infection control, and also between people in the community. Bacteria know no boundaries, and extensive international travel and trade help resistance to spread from continent to continent. Antibiotic resistance does not only affect humans, but also the health of animals and the environment. It is all connected. The unpleasant truth is that scientists have not come up with a new class of antibiotics since 1987, and we are about to enter a new era where many commonly used antibiotics have lost their effects. Modern medicine relies on the availability of effective antibiotics. Without them, it would be too risky to perform organ transplants, cancer chemotherapy, or even common surgical procedures such as hip replacements. Care of preterm babies would also be at higher risk for untreatable infections. Resistance is costly, both for the individual and for society. By 2050, the number of deaths due to antibiotic resistance could reach 10 million per year, and thus exceed the number of people who annually die from cancer today. Antibiotic resistance has been considered as dangerous and deadly as terrorism and global warming. Are we heading towards a post-antibiotic era? We cannot reverse this frightening trend, but we can slow it down. And all of us need to change our behavior to once again gain the upper hand in the fight against antibiotic-resistant bacteria.
Yes, so this is a call to action for all of us to join the fight, so to speak, against antimicrobial resistance. So as we proceed, I just put a quick snapshot on the screen that captures, there's the study that was commissioned by the UK government that captures 10 million deaths by 2050, costing approximately $66 trillion pounds and about $100 trillion. So, we're saying that this is predicted to be 10 million deaths by 2050. And I just thought, what recent pandemic has happened? COVID. And I looked at the data. This data is from today. I updated the data from today, and it captures that to date, globally, the death toll of COVID has been just over 7 million deaths total, right? So from the projections, we're saying antimicrobial resistance is going to result in 10 million annually. And then I said, of course, we're talking about Africa, and I looked at the Africa total. If you remember, during COVID, there was a lot of projections of, 3 million dead bodies all over Africa. But one thing that we did, we're collecting data, we're analyzing the data across the continent. And to date, the deaths in Africa from COVID has been just over 250,000 deaths. And in relation to that, the projection shows that for antimicrobial resistance, it's going to hit about 4.1 million deaths. So the numbers, again, these are projections. So we need to do a lot of the real work to translate this into what this means in terms of our countries and our region. So some of the causes on the screen: overprescribing of antibiotics, we've mentioned, patients not finishing their medicines. We're healthcare professionals, we're One Health professionals, we're a multidisciplinary team, but also patients. So the question is, do you finish your antibiotic treatment? Overuse in antibiotics, overuse in livestock and farming, infection prevention, and this very important point about lack of new antibiotics being developed. So these are some of the causes. So let's go to more recently. There was a Lancet paper done that covered about 204 countries, and it shows and specifies that, AMR requires urgent action from policymakers, etc. And the global death from 2019 was just over 1.2 million deaths attributed to AMR. And when we bring it to Africa, as we always like to do, we see that this accounts for about, in 2019, 258,000 deaths in Africa, in sub-Saharan Africa, with more than half of that under 5. So in terms of COVID to date, that's just over the total amount of COVID to date. And this is in 1 year. So let's look at in practice what we can do, why we're here, and what the discussion looks like. So we're saying that, globally, there was a call to action for every country to develop a national action plan on antimicrobial resistance following the global initiative. And this is founded under 5 core pillars. And our internship programs, we also use the same core pillars in the teaching and the education. So the first is awareness and education, which of course we're doing here. Surveillance, infection prevention and control, access to antibiotics and antimicrobial stewardship, and then R&D. Each country, each country looks at their own unique challenges. And for Nigeria, after the first 5-year strategic plan, we also included the governance pillar to sort of look at how all this is being put together. So I just put a screenshot here of a real culture report from a lab. This is real. This is a real sample from a patient. Of course, all the patient information is covered, but it just shows you on the right-hand side, the resistance of all these products, all these antimicrobials for this particular culture is resistant to all these items and is only sensitive to 4, I believe. And this 4, if you look at it, ertapenem, imipenem, these are very expensive drugs. Gentamicin, of course, you don't want to go with gentamicin as a first line because of the ototoxicity risk, the risk of toxicity to the patient, etc. So it just shows you that this is real, where we're having limited access to treatment options. So we're calling for a call to action from the One Health sector and including the veterinary team, because a lot of Yes, so we're calling for you to a call to action to join the the fight to address antimicrobial resistance, and we're hoping that you're going to participate in that. So we have Pan-African challenges, including youth inclusion. We have inadequate pre-service training and knowledge on AMR, and poor interprofessional and One Health education inclusion. So to address this, we have a youth strategy for innovation, where we're looking at capacity empowerment, we're looking at solution providers, also in line with exactly what Professor Renee said, creating problem solvers, building the research capacity across the continent, and always striving for this Africa we want, using data for impact, which is very, very key. So we just want to say that, you know, one of our initiatives as we're here is the Youth Against Antimicrobial Misuse Program. And the objective is centered around educating, creating that knowledge, so that the youth can be involved in stopping the spread of antimicrobial resistance, or mitigating or minimizing it. And then, of course, saving the future and these precious commodities we need for modern medicine. So we target, you know, secondary schools, etc. And our youth, our internship and mentorship program is one of our targets of this program. So this program looks at involving the youth in the mitigation, like I mentioned, and the duration is, so far we've done 3 cohorts, so they've been either 3 months or 4 months, and it's Pan-African, it's virtual, and we target the streams, including pharmacy, human medicine, microbiology, public health, environmental science, and it's structured over 12 to 16 weeks, and it's very multidisciplinary, very One Health focused. And, you know, on this virtual platform of learning, involving very interactive panel discussions, classes, and, you know, doing a curriculum project. So the modules have, you know, spread across giving solutions and creating strategies for the youth to be able to address antimicrobial resistance, data analysis, research and publication, advocacy, leadership, you know, creating future public health leaders, and of course, guidance for careers and next steps for our interns. So this is just a run through of the 3 cohorts. So this is the first cohort, which started in the middle of COVID, I must add, and it started off with pharmacists alone with 10 interns. And then we moved on to the second cohort, which included more One Health approach, as we saw the strong need for this, and included the medics, the vets, the agriculture students, etc. And we also tried to touch on the Francophone African countries as well. And this is the current and the third cohort, which you're going to hear from some of our interns shortly, which again is One Health and captures, and is just about to end next week. So in terms of what would you do differently, I want you to, you know, the call to action for you to become a leader, to be an AMR champion, and apply for, there's going to be a cohort 4 coming up shortly. The information about this will be shared as soon as it's launched with all of you that are on this call, and to collaborate with each other, collaborate with other youths. Think of how you can be that value addition and add value to provide solutions to this antimicrobial resistance, and of course, global health in Africa, because a lot of the lessons and guidance we provide on the internship are transferable to other global health initiatives. So look at the 5 pillars or more, depending on your countries, and see where you can add that value. So I just want to put a call for you to say that we need the youth voices in AMR, and thank you so much for your time. Over to you, Beulah. Thank you, thank you, thank you.
Thank you very much, from Estelle, for that very wonderful presentation and an overview of the JCW Foundation Internship Mentorship Program on One Health and antimicrobial resistance. So I don't know if Charles can continue to share his slides. Thank you very much. So just like from Estelle mentioned, very quickly we'll be having about 5 of our interns in the current cohorts come up to share their experiences through the internship program so far. So just to mention again, in this current cohort, we have about 20 interns, and they're from 8 African countries. We have a ratio of 7 females to 13 males, and they're all from 5 One Health disciplines, including medicine, veterinary medicine, pharmacy, environmental science, and public health. Next slide, please. Also in this cohort of the internship program, we have about 20 mentors, and they are also from 10 different countries in Africa. We have a ratio of 8 males to 12 females. And in fact, just to mention that some of our mentors are currently on this webinar. We have Dr. Oluchi Mbamalu currently on the call. Thank you so much, Dr. Oluchi, for joining. Next slide, please. Yes, so just as I mentioned, we're going to be having 5 of our interns from this current cohort come up to share their experiences. So I'll do a quick run through their bios. So first we have Zaharuddin Malami, who is a pharmacist, is from Nigeria. So he has a fervor for clinical and community pharmacy, public health, pharmacy logistics, and supply chain management. He's earned a bachelor's degree in pharmacy from the Usmanu Danfodio University, Sokoto State in Nigeria. After his graduation in 2021, he completed his mandatory internship at the Hospitals Management Board, Abuja, where he gained extensive experience in clinical pharmacy, administrative pharmacy, research, and logistics. Next slide, please. We also have Musin Atsumani. So Musin is from Tanzania, and his stream is environmental science. He was born in Morogoro region, Tanzania on May 2nd, 2000, and currently resides in Dar es Salaam, Tanzania. His educational journey led him to Muhimbili University of Health and Allied Sciences, where he pursued a bachelor's degree in environmental health sciences from 2020 to about 2023. He takes pride in achieving an upper second grade 4.0 GPA, which reflects, of course, his unwavering commitment to academic excellence. He's also a versatile communicator. He's proficient in both Swahili and English. In addition to his strong communication skills, he's adept in using various computer applications and is experienced in research and data analysis with tools like SPSS. Next slide, please. We also have Olojo Mohideen Opayemi, who's from Nigeria, as well as in the public health stream. So Olojo is a public health professional with a strong passion for advancing prevention and control strategies for antimicrobial resistance, particularly in resource-limited settings. He holds a Bachelor of Science degree in public health from Kwara State University, Nigeria, and currently he's serving as a core member at the Afin Primary Healthcare Center in Oyo State, Nigeria. His professional experience includes immunization, malaria control, One Health, water sanitation and hygiene, WASH. He aims to become a leading advocate for raising awareness about AMR across Africa. Next slide, please. We also have Dr. Gaspard Junior Ayisi, who's from Cameroon and also in the veterinary medicine stream. So he's a young veterinary graduate from the School of Veterinary Medicine and Sciences at the University of Ngaoundéré, Cameroon. He firmly believes that everyone has a role to play in preserving global health. His research work is primarily focused on public health, where he has actively participated in over 5 research projects. These projects revolve around topics such as antimicrobial resistance in food-producing animals and strategies for mitigating it through bioprevention. Additionally, he has contributed to research on the epidemiology of zoonotic diseases in Cameroon and has volunteered in sensitization campaigns regarding COVID-19 vaccination and antimicrobial usage. Next slide, please. And lastly, we have Dr. Abigail Keleba Johnson, who's from Ghana, as well as in the medicine stream. So Abigail is a 28-year-old Ghanaian. She graduated from the University of Health and Allied Sciences in Ghana in 2017 and completed a 4-year medicine program at the University of Ghana Medical School in 2022. Currently, she's in her first year of housemanship at the Kolebo Teaching Hospital. Beyond her medical journey, she's been actively involved in working with the Ghana Health Service, Bill and Melinda Gates Foundation, and the World Health Organization on the expanded program on immunization in Ghana since 2019. She's also enrolled in an MPhil program in medical biochemistry at the University of Ghana Medical School. So join me to welcome Zaharuddin Malami to make his presentation in about 5 minutes, talking through his experiences as an intern in this cohort 3 program. Thank you. Over to you, Zaharuddin.
Good evening, everyone. I'm
Good
audible,
evening.
Ms. Bella.
Yes, you're audible, Zaharuddin.
Okay. So I'm expected to on my video. I don't know if anybody can see me. I'm Ms. Bella. You'll also help me through this presentation.
Of course, we can see you.
All right, thank you. So, good evening, everyone. I was here in Nigeria. First of all, my name is Zaharuddin Malemi. Just like you mentioned, my name is Zaharuddin Malemi. I'm a pharmacist based in Nigeria. I'm currently one of the interns under the third cohort DBF One Health Air Environment Internship Program. So I'm here to just give a brief presentation of my experience as an intern under this wonderful and excellent program. Next slide, please, from Charles. Am I audible? Next, from Charles. All right, okay. So honestly, before I go much into the presentation, as pharmacist Estelle was talking earlier, I was telling a colleague of mine that she has basically done my presentation for me, because these are things I learned after coming into this program. I'm a pharmacist. I'm a recent graduate of pharmacist. I know what antimicrobial resistance is because we have been taught in our school. I know I have the basic knowledge. I know that microbes being resistant to antibiotic, and they're no more being sensitive to the same antibiotic that they were sensitive to before. But the global aspect of antimicrobial resistance being a global health issue is burdening Africa, the roles of youth in mitigating antimicrobial resistance, all of those things, those I did not know. But with this program, I was able to have an insight and first-hand knowledge on all of these things. Like she mentioned in her presentation, antimicrobial resistance is a global health issue. It has caused around 4 million deaths, over 4 million deaths attributed to antimicrobial resistance, which was published by a Lancet study. Due to this arising public health issue, there was a need to develop a global action plan on AMR, which was done in May 2015 by the World Health Assembly. It was based on 5 strategic objectives: awareness, which is the first and foremost the most important thing, awareness, surveillance, infection prevention and control methods, optimization on the use of antibiotics, and support in research and development of innovative ways to combat antimicrobial resistance. So the member countries of the World Health Assembly each took on these 5 strategic objectives to develop national action plan. I'm from Nigeria. The National Action Plan of Nigeria was developed in 2017. It was expected to stretch for a period of 5 years, 2022. So currently, there is a National Action Plan 2.0, which is, I believe, is under progress. The results of youth in mitigating antimicrobial resistance and misuse in Africa. Looking at the population of youth in Africa, we have a big role to play. I've always been told that youth are the leaders of tomorrow, but I've always thought that was more political thing, to bring about change in your community or your state or your country, but even in public health. All right, which reminds me, before I only hear public health in schools and all of that, but I was not, to be honest, I wasn't passionate about it. I wasn't really much into public health and all of that. I didn't even know, I just thought that, okay, after pharmacy, I'll go to a premise or practice as a hospital pharmacist and be like, okay, dispense morning, afternoon, and night, give the same antibiotics all over or different medications or different medications. But coming to this program, okay, sorry about that. I think I was muted by the host. So I was saying, I thought my career path was more of going to a chemist or a hospital to be dispensing antibiotics or drugs morning, afternoon, and night. But then, because of this program, I have learned that I have a role to play. No matter how small it may seem, even if it's just educating the people around you, people in your community about the issue of antimicrobial resistance, about what it can cause. Common infection like flu or let's say malaria, because antimicrobial resistance doesn't just stop on bacterial infections. We have parasitic infections, viral infections, and other infections that we know of. So my own role, I believe, so far coming to this program is more of being more confident in my approach to antimicrobial resistance, educating the people around me, because I'm practicing in a hospital right now. So whenever a patient comes, I tell them that this and that. Whenever it comes to antibiotic, like Ms. Biola mentioned earlier, some of us, Professor Rene, I think she was on that mentioned this about some illnesses not even needing to be treated with antibiotics, but then you just dispense the antibiotic. So this misuse and overuse of antibiotics is one of the causing, causative agent of antimicrobial resistance, where you see an infection and maybe a disease that does not need to be treated with antibiotic, it goes away on its own, but then you still dispense antibiotic. So I believe that that's also part of the education that I can offer to people around me. Because I have a concise short period of time, I will try to be fast. So during this program, there were some internship sessions that we had, and the key ones that I was interested in is all about that are listed here: tips on research and publications. Because as scientists, you need to be able to perform a good research. Honestly, I wasn't a research enthusiast, but with this program, I learned basic tips on research, how to be able to, pass out the information that I know or I have, found out or collected or something like that. You need to be able to present your information to the global space. African history and public health narrative is one of my best sessions. It was taken by Dr. Alex Coutinho, a global health leader, where he was talking about the history of Africa and public health narratives. I think he ignited my passion for politics, or my passion for public health. Basically saying public health is politics, politics is public health. All right, next slide, please. Next slide, Charles. Impact of the internship program: the skills I've gained: data analysis in public health, research and publications, project management, professional and personal development, networking with like-minded peers across Africa. Even though it was a virtual internship, it felt more of a physical because of the connections I've made with my peers in Africa. One Health concept and One Health approach, knowing about the One Health concept and approach. Next slide, please. Lifelong mentors. Like Ms. Bella mentioned earlier, I have a mentor, though I was given one mentor, but over the course, I've had like more than 2 to 3 mentors, networking with like-minded peers, professionals, One Health professionals, becoming a One Health Lessons ambassador, which was made possible from this internship. And the tips for prospective interns, I may say that I have developed your technical skills, such as research, data analysis, public speaking, community engagement. Okay, you have to be involved in your community because whatever solution you're trying to provide, I think it begins in your community first. Passion for solving public health issues. You need to be passionate about this. Next slide. My plans after internship. Like I mentioned, I'm more passionate about public health, so I intend to further my studies in public health and develop the technical skills learned during the internship. Next slide. Thank you for listening.
Okay, thank you very much from Zaharuddin for that, very, would I say, brief presentation. So now we'd go over to Olojo Mohideen. Mohideen, over to you. Hello, Mohideen, are you able to speak? Can anyone hear me?
Yes, we can. Maybe you can go to the next one.
Okay. Yeah. Next slides, please, Charles. Yeah, so now we'll move over to Muhsin Atumani, who is from Tanzania and also an intern from the environmental science stream. Muhsin, over to you.
Okay, thank you so much. Good evening from Tanzania. As was introduced, my name is Mohsin Rashid Athman, an intern in Dosity Blue Foundation, Cohort 3. So actually, I started this journey in the last year with Dosity Blue Foundation, and I'm enjoying to be here because I learn a lot in public health issues as my co-part of my journey in education status as an environmental health scientist. Graduated in 2023 in Muhimbili University of Health and Allied Sciences. So let us move to the internship experience that again from Ducity Blue Foundation. That's you see in the slide is just to mention a few, but there is a lot that we are learning from Ducity Blue Foundation. Among the important things that we are learning is the IMR burden. We get to know how AMR is burden in Africa and what that large as. We get to know the projected number of deaths and the projected cost that will be occurred due to AMR. As explained by pharmacist Esther, approximately 10 million deaths by 2050. So is among the area that we are learning a lot about AMR. What is AMR is, what are the burden, on how we can control it. So a lot and a lot. Also, we learn about advocacy among the experience that I get from the Ducity Blue Foundation, as we are learning on how we can do advocacy and we get on practice to educate peoples on how we can what is AMR and how can we remove the problem of this. So we get learning that. Also, we have an experience in One Health issues in One Health, as we get certificate in One Health Lesson Ambassador, as we are taught about on how you can be One Health Lesson, and we get a chance to teach a student or to teach various peoples, so as we can be One Health Ambassador. As One Health is among the important issues that can be used to address the AMR problem. It involves the three different disciplines, that is environmental health science, animal health, and medicine, human medicine. This is important part that can be used to solve the problem of AMR. Also, among the important things that I experience is about IPC, infection prevention and control. As part, I experienced more during our capstone project in our group as we take part in IPC part. So we learn a lot about IPC. Also, we learn about the National Action Plan, on how a National Action Plan was developed due to we done a review of National Action Plan. For example, National Action Plan in Tanzania was developed in 2027 and the current is developed in 2022. So we learn how we can develop a National Action Plan for EMA. Also, we learn on how we can implement this National Action Plan and what actually the peoples that involved in National Action Plan to develop the National Action Plan. So also we are learning about engagement, how we can do about community engagement so as to solve various problems, especially this AMR that is faced a lot of people and a lot in the world. Next slide, please. So skills and lesson learned is about antimicrobial stewardship. Also about surveillance, proposal writing. We learn on how we can write a proposal. Also, we learn about how we can use social media, how we can use LinkedIn to promote ourselves, how we can promote ourselves as a public health leader. So we learn a lot about that. Also, we learn about how we can develop a research, on how we can do a research. This among the important thing that as my interest in that. Also, data analysis. We have taught about how we can use Stata to do analysis. So it's among the important things in research. Also, we learn about leadership skills. We get about learning about leadership skills because we have a different session about leadership and governance. So this among the important things that here is important in public. Upcoming public health leaders, you are supposed to get experience in those leadership skills and so forth. Also, we learn about the project management, how we can manage a project, how we can manage those projects that maybe which will benefit or remove this problem of AMR. So this is just to mention a few, but there is a lot of skills that and lessons that we are learning. We are learning a lot actually. So it's just to mention a few. Also, advice for further applicant, apply for internship in Ducity Blue Foundation. You will enjoy and you'll get different skills and maybe will be the start of your journey in public health. Also apply different trainings. keep on applying different training that happen that is important as upcoming public health leaders. Also learn different skills that important, such as those the soft skills are very important as public health leaders. Also learn how to use those social media, as I explained before. Plan to conduct a project and research, find a mentor. This is among the important things. As you grow as a public health leader, you're supposed to have a mentor and find a right mentor that can mentor you well, so as you can do your things in a clear way. So this is among the important things. Find a mentor as you grow up in public health leaders. Also learn project management skills. This is among the important things that you're supposed to learn as upcoming public health leaders. Also learn and practice leadership skills. It's very important to learn leadership and skills and practice it and manage your time. This is among the important things that we get to know through the platform of Ducity Blue Foundation. We have a session on about how you can manage your time. You have a different task, how you can prioritize your task, and how you can plan for your time according to the task that you have. So this is among the important things that you're supposed to do. Also planning after graduation, get more involved in community engagement, promote more awareness and so forth. Also attending conference. This is among the important things. As you grow, you are supposed to attend various conferences as you get new knowledge. Also apply for further studies and apply various training that is very important as I grow as public health leaders. Also learn more skills such as research, that's a project model, data analysis and leadership, and conduct a project and research. Next slide, please. So in conclusion, that is my journey, and thank you.
Thank you very much, Musin. So we'll go over to the next speaker, who's Dr. Abigail Johnson, of course, from Ghana in the medicine stream. So Dr. Abigail, in 5 minutes, please tell us about your internship experience so far. Dr. Abigail, you're muted.
Hello.
Hi, we can hear you.
Please, can you confirm if you can hear me?
Yes, we can hear you.
Okay, great. All right, so my name is Abigail Johnson. I was part of the cohort 3 of the Ducity Blue Foundation AMR Internship Mentorship Program, and I offered human medicine. So I was in, yes, as a human medicine intern mentee as part of the One Health experience. So my internship experience, I must say that for our entire experience with Ducity Blue Foundation on this AMR mentorship was quite a very exhaustive experience. We covered almost everything. At a point, I was actually wondering if I was offering a master's program, or this was just a training session as a 4-month training session. We're virtually touching on. And of these, being a medical doctor, I had come across the concept of AMR, but I got to realize how little I knew of AMR through this internship. So I got to understand the role of One Health in helping us deal with this antimicrobial resistance problems. So I got to understand how animal health contributed, in fact, greatly to the burden of AMR in our setting. And I also got to understand certain principles I could apply as a medical doctor, principles that are easily overlooked in our setting, in a hospital setting, such as infection prevention protocols, which can be easily overlooked, especially in a very busy setting. And we are more focused on attending to the patients and treating medical condition, not realizing that your infection prevention protocols, if not optimum, is what would actually be causing the very problems you're trying to face. So I learned some of these things. I was introduced for the first time to surveillance systems, WHO surveillance systems like the GLASS, that's the Global Antimicrobial Resistance and youth surveillance system, and then the FAO Atlas system was my first encounter with these things, AMR surveillance systems. And for the first time also, we got to also review our national action plan. I honestly didn't know anything about the national action plan for on AMR for my country, but fortunately, unfortunately for me, I was the only Ghanaian in my cohort, and I found myself reviewing a national action plan on AMR, which was quite enlightening, and I actually find it as a very good step in other for further future initiatives and also for monitoring to see how far my country is doing in terms of antimicrobial resistance and also in my career progress on AMR in future. We also had the WOW week. The WOW week was on an antimicrobial resistance like awareness week, and it was a very great week. It was great in that it was my first time actually ever participating that actively in such a program, and also connecting to other people and getting to actually know extensively the work people are doing in antimicrobial resistance. And also we also got the opportunity to also pitch in the contest, develop projects, and also pitch in contests with our colleagues. Okay, one thing I have benefited greatly from with this program was with regards to mentorship. I would say I was one person that really greatly needed a mentor because I have very diverse interests in research and also in medicine. And it's most of the time it's not easy to find someone who blends these various backgrounds, but it was actually great having a mentor who could actually guide and help me in things like this. Okay, next slide, please. So for the skills and lessons, most of which I've mentioned in my previous slides, but I think research skills was one thing I really learned a lot from basic research skills. But I think what really responded with me was in writing of say a manuscript and how to go about a research paper and the kind of journals to target with regards to the kind of research you are doing, and then conducting a systematic review. These were very amazing skills I know would be with me for life, and I'm really grateful I was able to learn these kind of things. And a picture on the left was me having a public speaking session during my One Health Lessons lecture to a group of primary students, and this was an experience I got during this internship program. Other skills I gained were skills that very simple skills like how to organize like your Gmail, how to use Stata, a statistical device, LinkedIn, communication skills, etc. Okay, next slide, please. Thank you. So for my takeaway, the takeaways I learned from this program was no matter how little, wherever you are, no change is too small. You can make a difference no matter where you are. And this Blue Foundation AMR internship program actually gives you the skills and the knowledge to be able to make a difference wherever you are, no matter how little. You can make an impactful difference, and to make the most of every opportunity you are given, to be able to invest in the right relationships, which I have done a lot. I'm very happy about the relationships I've been able to build. And there was one thing that also resounded with me was being prepared to be prepared, which I saw a lot in our founder from Estelle, in how much planning and coordination was that went into every activity and everything that we did. And I think that was one thing that really stuck with me. And also another thing was the fact that the future of public health is ours, and that whatever difference we made out of public health of this future was up to us, and I plan to make the most of it. So for my future aspirations, I want to further my career in public health leadership, even though I aspire to I want to be a physician, however, with an immense background in public health and also in AMR research and stewardship. Also, I also intend to help in mentoring the youth in my Thank you. So.
Yeah, it's fine, Abigail. Our sincere apologies. We had to, cut you short there because we have 2 more interns to speak, and time is not on our side at all. So thank you very much once again, Abigail. So up next we have Gaspard. Gaspard, please, in 5 minutes, just share your internship experience briefly. Thank you.
Okay, thank you, Mrs. Bella. I'm audible, please.
Yes, you are.
Okay, thank you. We will start by talking about the fact about AMR. As Farmer said, the African has the highest mortality rate from AMR infection in the world. So young One Health professionals have a key role in fighting AMR by influencing their colleagues or by influencing the community at all. Next slide, please. In my journey with the Juicy Blood Foundation, some useful activities under the 4 Cs intended by the One Health pillars, known as coordination, collaboration, communication. Some activities were done, including a capstone project in Nigeria, with the aim of evaluating the knowledge level of One Health final year students in Duke University. Also, we review national action plan of some country of my teammate, and also in the field, I had the opportunity to talk about One Health and AMR to young nurse students in Yaoundé city where I am now. This was done in all these activities were done using innovative strategies, multiculturalism overall. Talking about capacity building, we learn about some skill and some lesson that we look at in the next slide, please. Next slide, please. Okay, talking about skill gains, lesson learned during this journey, we learn, oh, sorry, the previous one, please. Okay, thank you, from Charles. Talking about skills, we learn about leadership, we learn about World Health education, we learn about critical thinking on AMR policies, about project management overall. Also, as a veterinarian, I learned that I should be specific in AMR prescription, in antimicrobial prescription, sorry, and with the objective to limit the propagation of AMR in the community. Next slide, please. According to the tips and advice for future applicants to the One Health AMR internship of the Juicy Blood Foundation, we have to focus on these citations. What you do makes a difference, and you have to decide what kind of difference you want to make. So we, as future applicants, you need to talk about leadership, to develop computer skills, to choose a great mentor, not only the most valuable, but a mentor, a good mentor. Let's say this, you need to talk about volunteerism and engage in some volunteer activities. Next slide, please. Okay, formally, I was graduate in December 2023 and involved in some One Health and AMR community-related activities. But even if this was with passion, with some competencies, but this was not with all the lessons learned and skill gained during this internship. So this internship was an amazing opportunity to learn and to engage in someone else's research project. So after the internship, I am looking to pursue a master's degree in veterinary public health or
Sorry, am I the only one who can no longer hear?
Yeah, I
yes,
can't.
Okay.
apologies about that. I think his network ceased for quite a bit. So we'll
keep
just
learning.
thank you very much,
Or
Gaspard.
even without funding, research is in the community. I think
Okay, thank you very
I am on
much.
time.
Hopefully. Thank you very much, Gaspard. So we'll just move over to Muhyiddin. Muhyiddin are able to speak, but if not, we'll continue to the questions and answers segment. Muhyiddin? Okay, so I doubt he's able to speak.
Hello. Yeah, hello.
Okay.
Am I audible? Yeah, good evening from Nigeria.
Good evening.
Evening,
Briefly tell
everyone.
us about, so you just briefly tell us about your internship experience because we're pressed for time at the moment.
Okay. Yeah. Sorry, I'm okay. Yeah. The first slide, please. Yeah, good evening, everyone. Good evening from Nigeria. Yeah, my name is Olojo Muhyiddin Opeyemi. Yeah, I am presently an AMR and One Health intern at GC Blue Foundation. I graduated my first degree 2022 in the stream of public health. And my background in journey of public health starts from right from my first degree actually. And I found myself opportune to be a current intern at this present cohort at our GC Blue Foundation. Here's my internship experience according to this showing a slide on our screen. Yeah, I got to know about AMR prevention and control, as it is a global health issues, and it is when I am involved in this internship and mentorship program. So that is when I got to know deeply what AMR is all about, what it entails. Actually, I've been hearing about it in the past, but with little knowledge. But since my involvement in this internship program, so I'm opportunity to know more about it. Yeah, regarding this current slide, the skills gained in this program. Yes, leadership and teamwork. I gain more skills about how to work with different professionals from different backgrounds in the field of public health. So, and also in my communication, I think I find myself more improved in that, because in this program, in this internship program, so we were once involved in One Health lesson teaching, where we went around to teach those that are yet to know more about what AMR is all about and what One Health is all about. So I think me impacting knowledge to others, I am more improved in my communication, also in data collection using some tools like a Kubo Toolbox, and in data analysis as well using Starter 15. Among the sessions we've received. Yes, regarding this current slide, the biggest takeaway is, I know how to prioritize, different tasks for me. I know what to do immediately the one I need to delegate to another person, or the one I need to reach a duty until another time. So a lot of it, and also how to manage my time effectively, and also I grow more personally and professionally. And also seeking my advice to coming intern is AMR and One Health internship program. Let us seek more mentorship opportunities. Let us seek those who have achieved some tangible things in life and who we think and we know very well that it can uplift us to achieve our aim very well. And let us make use of our time very well. And using this current slide, I think I am being rushed due to time frame before me. And my plan after the graduation in this internship is to further into my education, pursuing a Master of Public Health, and also to seek around more trainings regarding that can improve me more in the field of public health, and seeking more career opportunities as well. Also, I am also committed to making positive impact in global health. Like I will still seek, regarding my present mentorship with my mentor. So I don't want it to come to an end. Like I aim it continues that way till I get to where I'm going in life. And also, commitment to growth, like ensuring continuous mentorship. Okay, that is what I just explained right now. So it has been fascinating a lot, being involving in this AMR and One Health internship and mentorship program in this cohort 3. So I find myself opportune. So thank you so much, GC2 team. Thank you, my teammates, my capstone project, all my colleagues in my present interns, my fellow interns. I thank you all. Thank you for listening to everyone. Thank you.
Thank you very much, Muhyiddin, for that presentation. So thank you to all our interns for your presentation. So far, I believe our participants in the audience have learned so much about their experience so far. So right now, we'll take questions and answers, but in the meantime, I'd like to hand over to Professor Renee for the contributions with regards to the Q&A as well as the breakout rooms. Thank you. Over to you now, Professor Renee.
All right, thank you very much. What I'm going to ask is that if anyone, so first of all, let me just say thank you and appreciate the amazing work that was done in DISIT Blue for this cohort, and also thank you very much for the presentations. Certainly the content of the presentation serves as an inspiration to others to certainly ensure that things move forward. And that we can address the issue of antimicrobial resistance and general One Health issues. So what I'm going to do now is I'm going to ask that we answer any questions that there may be. So I remember from the chat that there was a question that was actually posed to, I think it was posed by, is it Vanessa? No, it was posed by, I actually don't know who posed it. The question is, it's obvious that AMR is one among global security and health agenda, but countries are not working in an integrated manner, and the problem is coming from frontline issues time to time, and the impact is clearly prominent. So what do you think, in what way it is implemented in African context? So can I actually ask the person who asked the question to please unmute themselves and just ask? Thank you very much. Estelle, is there something that you would be happy to take on, please? I'm not sure who else has asked the question, and if there's anyone else who has another question, if you have a question about the actual internship for, as part of DISIT Blue Foundation, if you have a question that is posed for the Stellenbosch University Africa Network, please feel free. So Deborah, thank you. I see your hand. I just want to check with Estelle whether you want to respond to the question that was asked in the chat or whether we can just go straight to Deborah's question.
Thank you so much, Prof. Renee. I was actually trying to see, I didn't get the full question. Sorry, I was trying to see if I could find it whilst you were speaking.
Oh, okay. So let me. Yes, I think I hear someone speaking there. So what I'll do, I'll just repost it. I'll repost it in the chat quickly. And whilst you're reading it, I'm going to ask Deborah if you can pose your question, please. Thank you.
Okay, thank you. I just wanted to ask about the internship. Like, is it only for, because I saw on one of her presentation, I screenshotted something like the internship on the date on when it was starting, and I'm actually really interested, but is it only open for people who are like located in Africa? Is it also located, available for other students, maybe abroad? And and my second question is, how do I join? Because I heard about it, but then how do I actually join this internship program? Thank
you. Maybe I can start with this question. Thank you so much for your question, Deborah, and thank you for your interest. Excuse me. Yes, well, I don't know. What country are you from? Let me start with that.
I'm from Eswatini, Swaziland, but I'm currently in Spain.
So
I think a group of us here, some were in Spain, but were Africans who are studying medicine here.
Oh, got it. So the internship, it's focused on people that are resident or from Africa. And the reason why we do it that way, so that when we're looking at things like the National Action Plan, like someone mentioned, you have access to some of these documents, which of course we know is virtual. You can get access to some of them virtually, but we've just always tried to have it that people are resident and from Africa. But maybe you've created a food for thought for us, for people like yourself that are from Africa. I don't know your plans, because the thing is, we're trying to develop the capacity in the region. So I don't know if your plans are after your studies to come back. And of course, people that are from outside the continent, and living outside can also still contribute to the region. So you've posed the question to me. You've put a food for thought for myself and our team as we're thinking of the next cohort. If to restrict it to people as we have that are only in Africa, or if to open it up to people like yourself. So you've posed a question that we'll have to discuss further. So thank you so much for that. That is a very important question. And I wish you all the best with your studies in Espanol.
Thank you.
I'm trying to learn Spanish on Duolingo at the moment. So maybe you might be my practice buddy for Spanish.
All right. So I see that someone called Benjamin Ozier has his hand up, and while he speaks, I'm going to ask Beulah if you wouldn't mind resharing the slide that has the question on it that the students had to ask. Thank you very much. Over to you, Benjamin.
Good evening, everyone.
Please go ahead. Good evening.
Good evening, everyone. Can you hear me properly?
Yes, please go ahead.
Okay. I'm happy to be here, and I'm appreciating the organizers and the interns who have shared their presentation. It was a wonderful one. But my question is for the first presentation. I actually came in late, so I don't know if you wouldn't mind to give a recap of what the presentation was all about. I think it's from Stellenbosch University, I get. So what the program is all about, and who are those qualified to apply for the program, and is it a free one? And then my second is not a question, but an appeal to the DCID Blue Foundation. I applied for the last cohort, but unfortunately I was not taken. But one of the requirements is the person should be 2 years post-graduation. And so that means by this year, I can't apply because I would have been past 2 years post-graduation. So if that caveat can be reviewed, thank you.
Thank you. I'll answer the question. So I'm not able to, because of time, recap my presentation. But what we have done is, if you check the chat, you'll be able to see that there are brochures that provides an overview of the program. Then there's another brochure that provides an overview of the students who are core to participating into this, and they are from across Africa. And then we also have a sign-up form if you want to participate in the any of the webinars. So please feel free to refer to those documents. Thank you very much. I'm going to hand over to Estelle to answer the other question. Thank you.
Thank you so much, Prof. Renee. Just really quickly to answer your question. So this cohort we targeted recently graduated, less than 2 years. Previous cohorts had included undergrads as well. So we're constantly looking at the feedback and the dynamic of the course and, you know, the impact that we want to share. So just keep following our handles and our social media, and as we develop the next cohort, we'll see. We haven't finalized the inclusion criteria for that yet, but we'll also have opportunities like we're doing with Professor Renee now, that you'll be able to get more insight into some of these things as well. So follow the information and the links that Professor Renee shared for more information, because they have a whole webinar series coming up as well.
So I just want to say thank you very much for all the questions. What we are going to do, and we know it's late, and Estelle and I know that it's in South Africa, it's very much supper time, and I'm sure in West Africa, it's very much let's go to supper time. But what we want to do is we do want you as students to interact. So for the next 10 or so minutes, we are going to put you in breakout rooms. Please don't leave. There's no pressure in all of this. We'd like you to do a bit of a speed dating kind of discussion, but very briefly introduce yourselves, meet somebody from another country. The allocations are completely random. And then after you've done a very quick introduction, your name, your surname, and where you're from. At this stage, we can't really talk about more than that, but which country, what's your name and your surname, and are you a medical student, a health practitioner, a vet, what are you? And then very briefly give your opinion around the question. And if Beulah can just remind us what the question was that was put up earlier, that would be great. So before I do that, Beulah, are you able to just remind us what the question was that everyone was expected to answer? Thank you. And then I will put you in the breakout rooms and you'll be back within a few minutes. Thank you.
Oh, okay. Thank you very much, Professor Renee. So I believe, Charles, could you take the slides back to see the question, the slide, the question the participants were to, respond to, as I don't remember it offhand. Apologies.
So it was about the challenges that the youth face with regards to public health and public health issues. So, so I don't know if we should wait or if I should just send everyone to the breakout room, because I do want to give everyone time to talk. If I'm not mistaken, I think we are able to post that to all the breakout rooms. So I think go. Do not, we're going to have it very soon. Please do not leave the webinar. We'll see you. We won't let you go beyond the hour, we promise. So can you take us to the question, please? Very briefly, if you can just go through the slides.
Yeah, from Charles, please do that very quickly.
Okay, no, then I think let it be. So let's discuss what do you think the key challenge is. Estelle, any last words from you before we put them in their rooms?
No, I was just agreeing with you, Prof. Renee,
okay.
to say your plan to go to the breakout room.
All right, don't leave the call.
There.
Meet someone from somewhere else. See you soon. You should get a notice to join the room, so please click on it and join the room. Estelle, we are still able to type the exact question, so you're welcome to give it to me and I will just type it into our broadcast. Are people coming back?
Yes, we are.
Okay,
Yes, we are.
lovely, lovely. Okay, well, I suspect there wasn't enough time to have the discussion of the question. You can just give a thumbs up if my suspicions are correct.
Yes, there was loads of networking happening. Amazing networking.
So Estelle, we clearly need to set up a specific networking session where the students can
Yes.
chat.
Yes, it was amazing.
Yeah, so if there's, and I understand that some may not have finished the introductions at this stage, but what we will ask is that you, as we end of the meeting, and we're trying to honor time here, is that you put down in the chat box any additional thoughts around the questions or anything that you may have picked up. Also, you can express appreciation to any of the speakers that have, especially the interns who have spoken, and also just your sense and feeling around the webinar. So I'm going to say thank you very much, and I'm going to hand over to Estelle. Thanks, everyone.
Thank you so much, Professor Renee. This was very, very, it just shows we need to do more. I think the output of hard work is more work. We need to do a lot more. We need to definitely engage more. We need to build this platform more. I think this is something that, you know, we've started a journey and we just need to build on it to be able to finalize the, you know, to cement this as a norm for these networking sessions, you know, across our region, across our countries, across our programs, because just from the breakout room, people are doing really amazing work and we just need to do more. So I think I just want to use this opportunity to thank the teams that have worked to put this together from the Stellenbosch University. Amazing, amazing work. You know, with Professor Renee leading the team and guiding the team, but there's a lot of hard work that's gone into this. I want to really appreciate the team. I want to appreciate the Ducey Blue Solutions and Foundation team for all the hard work to pull this together. And definitely want to thank the participants for being here. You've put in your time, your effort, your discussion, your brain to be here. I want to also thank our interns for sharing their presentation. I want to thank the interns from both programs for sharing. This is a big starting, an opportunity that we're starting and a collaboration that I'm sure we're going to build on and have more opportunities to share and learn from each other. So this sharing and learning webinar has been a huge, huge learning experience for myself, and I'm sure for Professor Renee. We've learned from you all as well. And I'll just hand over to Beulah to give the final closing remarks, and then we close. Final, and then we close and round up. Thank you so much, everyone. Thank you all.
Okay, thank you very much, Estelle. I would like to sincerely thank Professor Renee as well as her team. Thank you so much for making this happen. Of course, without you, we would not have this webinar. So thank you so much for committing your time and your expertise. Thank you for sharing this with our participants. Also, thank you to the DBF team for your support on this webinar. Also to thank our participants, including our interns from the Ducey Blue Foundation, as well as interns from SU Africa. Thank you so much for joining us today. Also to thank our participants. Thank you so much, for making this a date with us. So I would just like to, mention that this session has come to an end, and please watch out for the slide deck, other important materials, as well as the recordings from this webinar that will be shared with every participant on this call. So thank you once again, and please enjoy the rest of your day.
Thank you. Thanks, everyone. Bye-bye.
Thank you.
Bye.
Bye.
Bye-bye.